My current role at CP Achieve is actually twofold. I'm doing PhD part-time with the CP, looking to develop preference-based quality of life for kids with cerebral palsy. And another part-time is working on the health economic bits of several projects across CP Achieve. For example, at the moment, I'm helping Dinah doing the data linkage on the project that they would like to understand more how the people with and without cerebral palsy use the health services. At the moment, I'm still busy working with my PhD, and I hope that I'm gonna wrap it up and finish it early next year. But some of the days still help out with the other applications or having a conversation with the group under CP Achieve about is there anything that economics can help them, or is there anything that they would like to know more using the health economics lens? For example, how can we see that the intervention is effective and what is the cost implications? I have been working in the disability and cerebral palsy around 2015. And 2016 is when I start doing my PhD in the quality of life related topic, because I've been working in disability before, and it is so intrigued to me how people quantify the quality of life, because we know it's not just only impacting the individual with disability, but also their families and carers as well. So it's really, really interesting topic. And that is pursuing me. I think it is a point of motivation of me to understand more the complexity of the world, which is called well-being, and also the quality of life. This question is a little bit tricky. Even my main interest is around measuring the quality of life and how to say which intervention is effective and also cost effective. But sometimes the intervention for individuals with impairment, not only the cerebral palsy, it can be very broad because it has an impact in so many ways. Even we mainly targeted, for example, how the hand can be functioning better, or how the kids can walk better, or how they can participate with their peers even better. It's not just only their health. They have some other impacts on the other aspects of life as well, and also probably their carers and probably their peers. And it also empowering them to be healthier and to be stronger through the stage of life that waiting ahead for them. Well, there are so many interesting projects within the CP Achieve. There are so many aspects that I haven't thought about it, but this just seems to make it really, really interesting with the skill set they have from the senior researchers and also young blood, like postgraduate, postdoc or PhD students. They're a really good team to work with. So it just depends on the topic. And I think they just make it really, really interesting. For example, the mental health team, or the participation, or the way that we try to find out the intervention that engage people with cerebral palsy to participate, or maybe participate is not just only in their education or school or university, but also in workforce as well. So there are all very interesting projects that I'm looking forward to get involved with. While working with the CP Achieve team, I think I enjoy working with different peoples with different background, and every one of them just coming in with a supportive mind. They don't really judge, oh, well, you come from another different discipline, you don't really understand this topic as well, but they're just trying to find the way to make the multidisciplinary at different skill set work together seamlessly. That is really, really interesting. And there are other fantastic support as well, like administrative staff and the network that they have, the way that they have the the consumer representative, to work as a researcher, to work as the administrator in the CP Achieve is really helpful. So most of the time, the research, we just produce the output and publish in a journal, or maybe put it on the shelf in the form of report and that sort of things. But it's hardly to see the change in the real world. So what's the point of doing all the hard work, but it doesn't make change in terms of like improving the well-being and the life of disability or people with cerebral palsy that we care? In 2022, what I want to achieve is finishing my PhD. That is the main goal. So I will free up my time to help more with other projects within CP Achieve. And I can support the PhD peer more as well, and also other projects that they require my skill.